Hi, my name is Dave Butler, and here at my clinic, Align Therapy, we see a lot of scoliosis, and we use the Schroth Method to treat scoliosis on a daily basis. And recently I had a patient that came in that asked what would help them be most successful in the Schroth Method. And they were asking what success rates were and stuff like that with their specific curve type and doing the Schroth Method. And as they were asking what makes them successful, it made me think about what would make them not successful in the Schroth Method. So this video is about what top three things make the Schroth Method not effective for you. This isn't saying that the Schroth Method is perfect, and it's not saying that it fails all the time because of these three things. But if you're doing the Schroth Method for scoliosis, or you have someone that you care about, or your child who's doing the Schroth Method for scoliosis, think about these three things and make sure that you're doing these or not doing them to get the best result possible. Don't forget to subscribe to the channel, and please comment if you have any comments about what I talk about today. I love to read the comments and I'll respond to those, so I appreciate you watching. The first thing the first reason that the Schroth Method may be failing for you is that you're not doing it consistently. That's the most common reason that I see in the clinic, that some of my patients don't get the results that they want out of the Schroth Method. They're not consistent. It's very common that I see someone for an evaluation and we start to go with treatment, and the energy is there and the excitement is there, and it's like, okay, we're gonna do something about this, we're gonna slow the progression, and then the problem is life happens. You know, life happens, and it's hard to be consistent with it. That's probably the number one problem that I see with people doing the Schroth Method, is you have to be consistent. Here at my clinic, we have our patients do exercises 5 days a week for about 30 minutes a day. And so you get 2 days off during the week, but you have to be consistent with those 5 days. And consistency is key. Just like anything, any habit, if we're consistent with a habit, then it becomes more of a habit. So if you're struggling with that reason, then I would suggest looking into ways to change habits to make it more consistent. There's a great book out there called Atomic Habits that you can read that is great for how to form better habits and how to break bad habits. So be consistent, and that's the first reason. People who are inconsistent with Schroth Method exercises don't get as good of a result. Number two, the second reason that the Schroth Method may be failing for you is that you're not thinking about the exercises enough. So one of the common problems I see, especially in my teenage patients, is they just go through the motions of the exercise. They don't really think through it, and they don't really try and connect what's happening with their body. So trying to connect the mind-body to understand and feel what's happening in the spine is very, very important. For example, one of the simplest exercise, well, it's not very simple, but one of the simpler exercises for the Schroth Method is just a semi-hang position. And in a semi-hang position, it looks like you're just hanging. And if you're just hanging, you're not getting the most benefit out of the exercise. So if I was doing the semi-hang exercise and I'm hanging down like this, and I'm just waiting, counting my breaths, sure, that's okay, but better is as I'm hanging and doing that I'm feeling for expansion through my ribs, that I'm feeling where my concave side is, and I'm expanding into the concavity, and I'm really trying to feel what's happening. If you can feel what's happening, then you can make that happen when the therapist isn't there poking on you. And so that's an important piece, that you have to be able to think through the exercise, feel what's happening, and understand what you're doing. I always ask my patients if they understand what they're doing, but I take that a step further and I have them teach me how to do the exercise. I do that not to quiz them or because I'm bored or anything like that. I'm doing that so that they can see how well they understand it, and so I can see how well they understand it. Because if they can't explain it to me in the clinic, chances are they're not doing it correctly at home. So do you understand it well enough that you could teach someone else how to do it, or describe what is going on with that exercise? So that's key number 2. If the Schroth method is failing for you, you might not be thinking about the exercises or understanding them well enough, and just going through the motions. So make sure you're not doing that. Number 3 reason that the Schroth method might be failing for you is you might be treated by someone who's not a certified Schroth provider. And I'm seeing this more and more, that sometimes I'll have patients come in and they'll tell me that they had a therapist that they were working with for the Schroth method. And I'll look up who that therapist is, and they're not certified in doing Schroth. They may have purchased the Schroth book, the book by Katarina Schroth, and read through it, and I mean, that's better than nothing. That's a tough book to get through, but getting the training that's needed to really address scoliosis is very important. So if you're being treated by someone who says that they're doing the Schroth method with you, make sure that they're actually trained in the Schroth method. There's a lot of videos out there. I mean, I do demonstrations on YouTube, and that's not to teach people how to do the Schroth method. This is to give you an idea of what it's like and give you an idea on how to get the best results out of it. So I see a lot of chiropractic out there that is claiming to do the Schroth method as well. If you are being treated by someone who's claiming to do the Schroth method, make sure that they've been trained in one of the schools for Schroth. That's either BSPTS, the Barcelona Scoliosis Physical Therapy School, the German school for Schroth, or SSOL, which is an online learning Schroth-based course. So make sure that's happening, because if they're not teaching you true principles and they're just calling it Schroth and doing their own thing mixed in with that, you might not be getting the best results that you could be getting. The research that's out there is about true Schroth, I should say, and so if you're doing something different than that, then you may not be getting as good of results as you could be. So hopefully this was helpful. If you found this to be helpful, check out our other videos. If you are looking to get Schroth treatment, or you're currently getting Schroth treatment, I hope that this was helpful to help you understand what to look for in a provider who does Schroth. And if you're in the area or you want to come visit us, we'd love to see you. Thanks for watching.